Hey everybody, thanks for being here. We got some music playing. We're being official now, Judy. I kind of like the new way
Right.
that we're going.
I like it. You picked some good music too. Some of the music people playing, like, why did they pick that? But
And
that's good. I like that.
you have so many titles to choose from. You can get caught in the black hole of selecting the ideal music. But we are so happy that you're watching us today. So welcome to the Art of Healing with your host, Dr. Judy Jasek of Animal Healing Arts, and Matt Rowe, myself of ParsleyPet. So during our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer and other unexplained illnesses. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Good to be here as always.
Oh, we're going to have fun today. So this topic I'm really excited about. So I was telling Dr. Judy last night, I was on a phone call with an incredible individual feeding raw and navigating that space. And her question right before we got off the call was, do I vaccinate my dog or not? And what are the rules? So this show is going to be all around to vaccinate your pet or not. So Dr. Judy, you actually brought this topic up when we first started talking about it. What are your thoughts? What's happening now that's got this in the forefront of your mind?
Well, I think pets have been over-vaccinated for a long time. I think the two main things I've really thought for a long time. I mean, probably over a decade now, that the two things we really need to improve for pet health, number one is nutrition, which we've talked about that, the raw feeding. And the second is don't over-vaccinate, because I think vaccines perpetuate inflammation in the body. They disrupt the immune system. They do so much more harm than good. And there's ways where we can make sure pets are protected so that we're not, subjecting them to diseases out there without over-vaccinating them. Because immunologically, once a body builds that antibody response, that response doesn't go away. And so from an immunologic, there's an immunologist, and I'm pretty sure he's retired now. His name is Ron Schultz, and he did a lot of research on this. And he basically said that there is no scientific evidence for the need for booster vaccines. Those and the other thing is, all of those recommendations are created by the vaccine companies. So follow the money, right? That's right. There's no independent research out there on vaccines. Jean Dodds is the only one. She was doing, she was doing a rabies trial to see how long, rabies antibodies would last. But aside from that, the research out there and all the recommendations, it all comes from the vaccine industries, the ones making it, all the labeling recommendations, even the state ordinances. I know here in Colorado, their rabies recommendations are based on what the vaccine companies recommend. So, and they're in the business of selling vaccines. So, follow the money, right?
Yeah. Oh, absolutely. I wish I could put a mandate out that it's required to test your dog every 6 months on nutrition, but that would be me driving that initiative, not really based upon the actual health of the animal. Now, I still think that it's extremely healthy to test your dog every 6 months, but really allowing, like you said, allowing the vaccine companies to dictate that, I think is incorrect. So I know that I receive a card annually to come in to get, booster shots or rabies or all of that type of stuff from my conventional veterinarian.
And what do you do with that? And what do you do with that card, Matt?
I don't tell my vet, I throw it away. And so,
okay, good. I was just checking.
Yeah. And really at that point, I want to go get a titer test.
Yeah.
There's no reason for me to vaccinate and add more potentially harmful chemicals into my dogs that are going to lead to just dangerous stuff like cancer or heavy metal exposure. And all of those pieces that go into it, really being able to take a look at it and say, okay, what antibodies does my dog have? And do I really need it?
Right. And I think what's happened in the profession, and this happened I think decades ago. I've been doing this a long time, and vaccines have been at the forefront of veterinary care for as long as I've been practicing. But I think the problem is they become the standard of care. So in a conventional veterinary clinic, clients are not talked to about nutrition, or if there is a health issue, they are given, a prescription diet, one of these horribly unhealthy diets. They don't talk to people about, well, if we could build a healthy immune system in the pet has an immune system. It's designed to fight disease. And if we focus on supporting that and keeping the pet healthy, that's where health comes from. That immune system is there for a reason, and it is to fight disease. The whole paradigm in veterinary medicine has become, well, the way to have a healthy pet is just take them in every year for their shots. And that's what a lot of people get on board with. They go in, they get these shots, and they go, okay, my pet's healthy. And then their pet gets cancer or some autoimmune disease or starts seizuring, and all these things that nobody knows where they come from, but they're not from the vaccines. This is what I hear. I think vaccines can contribute to these things, but I have seen many pets go back into their veterinarian or go into specialist and be told, oh, well, we don't know what causes this particular condition, but we know it can't be the vaccines. And why are they saying that? Because that's what the manufacturer told them. The only place that information is coming from. And I always ask when I see a pet with any sort of acute inflammatory reaction or chronic illness, I look at the vaccine history. And is there a correlation between when the vet was vaccinated, when the pet was vaccinated and the onset of symptoms? And very often there isn't. To be perfectly blunt, because my filters get really thin the older I get, but vaccines are a money-making thing. They're not about the pet's health. They're really about profit margin and business models and things like that. And they're sold to the veterinarians based on fear and on profitability. Those are the two selling points. When a pharmaceutical rep comes into a clinic, because I've listened to many of these spiels, and they sell you on two things. They sell you on fear. If you don't give your patients these vaccines, they're going to get sick, and then you could get sued, and on and on. And, oh, by the way, look at the profit margin on these and on vaccines. It is huge. I have been pulling vaccines out of my patients' health regimes for years. I even took that financial hit way back when I started vaccinating less and less and less. And wow, definitely there's a loss of income when you do that. But as I learned more and more about the dangers of vaccines, I couldn't do them anymore. And I even now in puppies, when I start puppies on vaccines, I do monovalent vaccines. So I do singular vaccines. So I vaccinate for parvo and distemper, two components. The average puppy vaccine or annual booster, they're all the same vaccines. They just call them different things. But a lot of them have 4, 5, 6 components. So you're giving all of these different components at the same time. And especially in young puppies, it can be extremely disrupting to the immune system, and sometimes permanently. So we have some of these permanent inflammatory conditions. So I actually give these monovalent vaccines, and I have found that if I do these vaccines when the puppies are a little older, so we're not starting them at 5, 6 weeks. We're doing 9 or 10 weeks on these vaccines. I do one set. I do one parvo, I do one distemper, and then I titer them a month later. And the majority of puppies, about 85%, will have a good titer after just one vaccine. So not even any boosters.
It's amazing. Like when you look at that, but yes, I mean, you said it is you follow the thread of money in so many cases. And I know, just from the human side, we are over vaccinating ourselves as human beings. And yes, I think it's important to have a vaccine, but to not check the antibodies in ourselves. And, case in point, especially with a puppy, And I think we vaccinate even under a moment of illness. So if we go in and we're ill, we still vaccinate even young children, which we're making the body fight so hard. The immune system is working so hard to just try to keep up. And then all of a sudden we're putting another pathogen in the way that our body is creating the antibodies to protect itself against, which is great. But if your body is already compromised, I don't think it's right. But I mean, do you see that with puppies and dogs that come in, that a dog might be compromised in some way, whether their health is affected, and the, whoever was in charge of providing vaccines at that time gave a vaccine anyhow?
Oh, I see it all the time. And I think, in my opinion, it's highly negligent. Actually, vaccines are actually labeled, if you actually read the label, only to be given to healthy animals. So that is actually on the label. But I see cancer patients go in, get vaccines. I had a client once, her dog was seizuring, went in and was given a rabies shot. And rabies, I mean, that's one of the side effects I've seen of the rabies vaccine, because it's a neurologic virus. It actually contributes, and it set off a horrible run of seizures in this dog.
Right.
You should absolutely never give any vaccine when a pet is sick in any way. I don't care if it's an ear infection, any kind of inflammation, and let alone a more serious systemic disease. It's like the profession just thinks, oh, these vaccines are just benign, and they're not. And so pets that are sick, and pets that are undergoing surgical procedures, anesthesia, I actually think a lot of the quote unquote problems that we hear about with anesthesia could actually be vaccine reactions, because I know a lot of pets, they're laying there, they're sedated. Hey, what a great time to just give them all their vaccines. And these pets are recovering from the anesthesia. If they've had a surgery, their body is healing from that. And then we pump them full of these vaccines. And that's another time where I think it's highly negligent to be giving vaccines then that they don't even need. I'm a firm believer that once we build immunity in a young animal, and we look at exposure, for cats, I don't even recommend vaccinating indoor cats. They're not exposed to anything. If they're truly indoor and they're not exposed, the only place they're going to get a disease, a virus, is from another cat, right? So if they're never going outside, and in this area, most people keep their cats indoors because it's dangerous. There's wildlife and dogs, and
we have birds of prey.
And all sorts of things out there. So most people keep their cats inside. So why are we vaccinating, these, indoor cats? Now, all pets technically are required to have rabies. Indoor cat, again, their risk of getting exposed to rabies is almost non-existent. So that's a choice of the pet parent, as far as keeping their pet on the up and up. If they're going to license with their county or local ordinance, city or county, whoever is their licensing entity where they live, then they'll have to do the rabies vaccination. So that's kind of a whole sideline on the rabies. From a disease prevention standpoint, it isn't necessary. And in dogs, if you gave, a rabies vaccine and started doing titers, you'd probably find that they had very adequate titers going forward. And from an immunological standpoint, it wouldn't be necessary. Now, if a dog goes out and bites somebody, which, can happen, dogs can get scared and something can happen, they can nip at somebody. And the first question asked is going to be, does the dog have a current rabies shot? And you can have a titer, and the animal control officers probably aren't going to know what it is. Most people, it's a matter of education. So that's a choice, for people to make. So there's a difference between disease prevention and following your, local ordinances. I've actually found that a lot of boarding kennels, training facilities, all these places that are now shut down because of the coronavirus, but they actually would be willing to accept titers once they were educated. To a large degree, sometimes not for rabies. Usually they would still require rabies, but I would sometimes call and talk to the owners of some of these facilities, explain what a titer is, explain what the test means, and they'd be very much on board with it once they understood.
Yep. So how much do you think that the doctor's hands are tied when they work at a clinic? Do you think it's mandated by the clinic that they have to provide vaccines because they look at it as that revenue stream? Or is it discretionary based upon the doctor and their feel to it to some degree? Or is it really that their hands are tied in some of these situations?
Well, I think in the corporate clinics, unfortunately, the veterinarian's hands are probably tied. They probably have specific protocols that they are expected to follow. So this is what we give pets every year. This is what we do. This is how we vaccinate puppies. This is our puppy vaccination protocol. So they probably are required to follow those mandates. So unfortunately, this is where because there's so many more corporate clinics, I feel it's so important that people are educated, because the bottom line is you still have the right to say no when it comes to your pet. There is no state law. There are clinics that will not work on your pet unless they're current on vaccines. And in my mind, that's ridiculous. Go someplace else would be my recommendation there. Because the two aren't even correlated. We won't look at your pet or treat your pet or examine your pet until we update the vaccines. Those two things are completely not correlated at all. So again, that's more about profit margin than it is about health.
That's interesting, because I've actually heard that statement made to me years ago when we had our first puppy and our first dog, that said we can't do anything to treat like a laceration on the paw until she is completely 100% vaccinated. And of course I was young, naive, not vaccinated. I didn't know better.
Right.
So you were talking a little bit about in today's current environment and in the current crisis today with a lot of drop-offs and that type of stuff. What would be your concern in that space?
Well, what's happening, from what I understand, is you drive up, you hand your pet over, and they go in to the clinic to be treated or examined. And I think a lot of clinics are backing off from doing routine procedures, except for vaccines, which is interesting. I have actually heard this. It's emergencies and vaccines that they can do.
Of course, they're not going to stop their revenue.
Right. They gotta pay the bills, right?
Right.
But what I would suggest to people is you tell them it's probably a technician that's going to be coming out and getting your pet. I don't actually know if people are even communicating directly with the veterinarians in this scenario. I kind of ask people when I hear about people going through this, what it's like. But from what I understand, there's not a lot of communication. But what I think is very, very important, that you insist on a written estimate before they do anything to your pet. So first of all, your pet is not getting unnecessary procedures, and they're not going to do a whole bunch of things and run up a big bill without your authorization. So I think that's really important. And actually, in the Veterinary Practice Act in Colorado, clients are to be allowed informed consent, which means that veterinarians, per our Practice Act, are supposed to be informing clients, and the clients make the final decision. And I hear many, many, many stories that is not the case, that things are just done without the client's direct consent, even when the clients were going in the clinic with their pets. And now, where they're just dropping them off curbside, I think that could be happening anywhere. Oh, look, the pet's due for vaccines, they're just doing them while they're here. And I think you just have to be very, very clear. You get a written estimate. You tell them you're not to do anything that you do not sign off on. And that should be general business practice anyway. They shouldn't be doing anything on your pet without getting your authorization. But because this is a new routine, things are a little crazy, clinics are busy, I just think that it would be very easy for things to be done without authorization. And then people just say, well, oh, well, that got done, but it's not okay. And I think people have to insist on that kind of communication and written consent when they drop their pets off.
Rightfully so, because I mean, your pet is your responsibility. I mean, 100%. If you put under a vaccine protocol that causes your dog to get sick, then you're back at the vet again, dealing with seizures or cancer or like all these other conditions that are not going to get attributed to a vaccine, but essentially, as you know, we're talking today about it, very well could be due to that, the entire scenario. And so, yeah, I mean, at one point you are, I think at every point, just like with our own families, we are responsible for being the adult caretaker for our loved ones, for our animals. And, you know, your dog doesn't have a voice. It can't say whether it wants it or not, or needs it or not. And if you're following just the script that's laid out to you, I think you might be missing some areas that you could actually have a stronger voice, like getting a titer test, you know, running that option instead of going after the vaccine route right away.
Right. Right. And maybe we could explain that a little bit too. So a titer test is where you're actually measuring antibody levels against a disease. And on the core vaccines, there's titer tests available for parvo and distemper and adenovirus, which are 3 common antigens that are used in a large majority of the vaccines. And you can get a 3-way test done to measure antibodies levels. So if you run this test and you find out, oh, your pet, has plenty of antibodies, they're protected against these diseases. They actually are supposedly going to be coming up with one of these tests for this coronavirus so that, we can detect immune individuals that have been exposed, have built an immunity that maybe don't have to worry so much about, future exposures.
Right.
And you can also get a titer test for rabies. Again, it's not a legal substitution for the vaccine. And that's just a time where pet parents need to make an educated decision on what's best for their pets. Now, Colorado does also allow us to write medical exemptions for rabies. So if the pet is sick in any way, we can write, there's a state form so it's totally legal. We can write a medical exemption saying, I don't feel like it's appropriate to give the pet this rabies vaccine for medical reasons. Now, from what I understand, a lot of veterinarians won't write them, just won't give them to people, which again, I think is silly, but that is an option. So ask for these things when you go in and you're like, I don't know if my pet needs all these vaccines. Ask for a titer test and, vote with your dollars. This is where this is so important. If the clinic you're going to doesn't do titer tests and that's what you want, then go someplace that does. I do them, but I think the more that you ask for these services at your clinics and you show that there's a demand, it's going to help maybe shift the way veterinarians are thinking or get them to learn a little bit more about it, that there's a different way. Like, oh, I got these clients coming in asking for these titer tests. Maybe I should look into that. Maybe I should start doing that. What is that? Like I see so many times that these things get shot down and without any good reason. And it's like, whoever is like in charge of the clinic just doesn't want to go there. They just don't want to learn about it. It's so much easier to just give them the vaccines. This is the way we do it. We're not going to change our protocols. Then go find someplace else that has a different protocol, because this is your pet's health that's on the line. And it's just super important.
I know oftentimes when we test heavy metal exposure, because we can do that with the nutritional blueprint, we test 7 different heavy metals and we ask about when's the last time that your dog received a vaccine. And oftentimes when we see vaccines that have been administered in the last 3 months, we're going to see increased levels of mercury and aluminum in every case. And so, for those that are saying, oh, they don't stabilize the vaccine using heavy metals, I think that's incorrect. I think they are definitely using heavy metals to stabilize vaccines because we can test for it. We can see it.
Yeah. Well, and the thing about that too is if it's below a certain amount, they don't have to put it on the label. Like I have a rabies vaccine I get that is thimerosal free. It's one of only, I mean, last time I looked into it, there was only one other brand on the market that did not put, that you could get a rabies vaccine that did not have thimerosal. But oftentimes if you read the package insert, it's not in there because it has to be above a certain percent before they're required to put it on the package insert. You have to go to the MSDS sheet, the material safety data sheet, where they have to put everything, and you can find it there. But not too many people are going to do that much digging. So that's another thing to ask, what preservatives are in these vaccines,
Yep.
What else is in them besides the antigens that we're trying to protect the pets against? Because these heavy metals, these mercury and aluminum, they're highly toxic. These are so bad for pets, and definitely could be contributing to the vaccine side effects that we see.
Yeah, I mean, that's oftentimes in reports where we'll see medical conditions that show seizures in a dog, and right, we don't anticipate it, but at some point when you look at the results of the test, you see increased incidences of mercury inside the dog system, which mercury, will lead to seizures. And you're looking at a lot of this stuff where, at some point it's eye-opening and it's rewarding to know that, yes, you do have a voice and you do have a choice. And I love how you said, speak with your dollars.
Absolutely. Absolutely. And these heavy metals too, from what I understand, they can accumulate. So there may only be a little bit in any one given vaccine, but if you've got a 6-year-old dog and it's been getting started with puppy vaccines and then it's been vaccinated every year, unless their body is able to effectively eliminate the mercury, and sometimes that doesn't happen, it can build up. So it can be an accumulated thing. And then they're 6 years old and they start seizuring. Oh, what's going on there? Heavy metal accumulation could definitely be playing a factor there.
Yeah, and there is, you look at mercury breaks the blood-brain barrier. So when you have, let's say, a mother dog that has a litter, when that litter is inside the womb, that is really, she is indirectly passing heavy metals, aka mercury, onto her puppies, just indirectly. Now it's done in a very small amount, but if it can break the blood-brain barrier, it can break the amniotic sac. Yep. And so you're seeing, dogs are seeing this. And especially if, I would imagine you don't vaccinate during pregnancy of a dog.
Right. Not recommended.
Yeah, not recommended, but I'm not saying that it is not done. So, but even like you talked about with accumulation, it sits in your organs, it sits in your liver, it sits in your spleen. You're looking at mercury. And this was explained to me by a doctor that said what mercury will do is it'll assume the responsibilities of some missed minerals inside your system. So let's say you are deficient in iron. And so what mercury will do will fit that part in the chain in order to allow it to act like the iron inside the system, even though it is mercury and toxic and painful and really harmful to the animal. So at that point, it's really this mercury is just like a catch-all. It will go in and it'll assume all these roles into other mineral levels that are deficient. And so when we're seeing that is scary, that those types of stuff can actually start affecting the animal, biologically. And that's when you're seeing a lot of these illnesses come in. So yeah, I think lesson learned is be careful.
Yeah. Be careful and speak up and trust your gut. I've also heard so many times people would come in and say, I just knew I shouldn't give that vaccine to my pet. I just knew it wasn't right, but the vet talked me into it and blah, blah,
Mm,
blah. And now the pet's sick. So trust your gut when you really think that, something is not appropriate for your pet or you're questioning it,
mhm.
just hold off. Hold
Yeah.
off. I mean, it is your choice. They can't force you to do anything.
Yep.
For that you don't want to for your pet. The decision is ultimately yours. And if you're not feeling good about something, get a second opinion, get more information
Yeah.
before putting your pet's health at risk.
And yeah, it's absolutely right. And if you don't feel that you're being supported by the current doctor that you're going to, and they're actually an advocate with you to determine what's the best health for your pet, go and find somebody that will call Dr. Judy and have a conversation with Dr. Judy, and she's, incredible when, really talking about health from that full spectrum, not only from the feeding side of it, what we should ideally be feeding our dogs, to also what treatments do my dogs have to have. So this leads into, you are still offering your $35 15-minute consultation. Is that correct?
Mm-hmm. Yep, I am. And
Awesome.
that's a brief mini consult. Do I need to take my dog to the vet? Because with these crazy times, I would imagine that people are a little more hesitant to just take their pet and drop them off and
Yeah.
at the curb and not be able to go in with them. And so I'm offering this little mini consult just to help you determine if your pet does need to go in. I was actually talking to my sister-in-law, called me this morning, and, her dog had vomited this morning and yesterday morning. And, is this something I need to be concerned about? And so we talked through, how's the dog acting otherwise? Is it still eating? Good energy? And we determined that, I don't think this is an emergency at this point, but these are some things to look out for. If it persists, the signs, persist or get worse, then, it's at some point that might be appropriate. But I can help people, and I can also help with some home remedies, that just some simple things you can do at home. For this little pup, I recommended some, chamomile tea. That's just very soothing. It's very gentle, something that can help just kind of calm and soothe the digestive tract. It's just a great, gentle herb. And so we can add something like that in just to help, because a lot of times, again, the body will resolve these things. I see a lot of people panic. I understand we want our pets to be healthy and we get worried when they're sick, but they also run into the vet and, $500 later, there's nothing wrong.
Yeah.
And not that there's anything wrong with doing that, if you're concerned about your pet, but, I think under current circumstances, it's worth being a little bit more discretionary, and I can discern a lot on the phone or on Zoom. So yeah, I do offer that as along with, full length phone or Zoom appointments for longer consultations. I'm also seeing pets on my back patio right now. So
Awesome.
outside my house, I wear my mask and
Beautiful outside right
my
now.
gloves. Oh, it's actually pretty nice because I get to go outside like this. I'm glad it's not December. I'd have to rethink that. But right now the weather's nice. So I feel like I can do that, do some appropriate social distancing. So I am working with that and helping people out as much as I can.
Isn't that awesome? And I love how you leaned into telemedicine and how you looked at that approach and really trying to offer, your patients everything that they could get, or everything that they need at that moment. And so I'm just unbelievably floored. So you can actually take a look at the actual telemedicine that Dr. Judy's putting on for that 15 minutes consultation for $35, and your URL. Now, I'm going to try to get this out of memory. AHVA.com.
It's ahavet.com.
HAAvet.com.
AHA. So it's Animal Healing Arts. And then, well, that's what it stands for. So ahavet.com.
Awesome. So check out everything Dr. Judy is doing, and definitely follow us on ParsleyPet. You can also follow Dr. Judy on her page. If you're watching this, thank you very much for being a part of our show today. I hope you took a little bit of knowledge from this and empowered you to be the best pet parent that I know you are. So thank you, Dr. Judy, for being on the show today. I really appreciate it.
Thanks, Matt. And thanks, everybody.
Yep. All right. We'll talk to you guys soon. And definitely check out Dr. Judy at ahavet.com. Did I do that right?
Yes, got it.
Awesome. Wonderful. I love it when I get it right. Okay. See you guys. Be safe, be healthy. Enjoy the rest of your days.
Bye.
Bye.